The lymphatic system consists of lymph vessels and lymph nodes. The vessels are how the fluid from the limbs and organs get to the lymph nodes. Lymph node basins are located in your neck, armpits, abdomen, and groin. The lymphatic system plays a large role in immune function. This is how your body fights off disease, infection, and cancer. It also plays a large role in circulation. As fluid moves out of the tissues through the lymph vessels, waste products, bacteria, dead cells, and large proteins are collected. This is then moved into a lymph node where it is broken down and filtered. The protein-rich fluid that remains is then transported back into the circulatory system. Lymph nodes are also where white blood cells are produced. These are important in your immune function. Lymphedema is defined as swelling in one or more limbs. It can affect the trunk, chest, back, and abdomen. It could even affect your head, neck, face, breasts, or genitals. Fluid in the body's tissues is called interstitial fluid. Once it enters a lymphatic vessel, it becomes lymph fluid. Lymphedema occurs when the lymphatic vessels can no longer transport the lymphatic fluid back to the circulatory system. This protein-rich fluid builds up in the body's tissue and creates visible swelling over time. Proteins draw water to themselves, which makes the swelling worse as it pulls fluid from the circulatory system. Over time, if lymphedema is not treated, the swelling in the tissue will get worse and it will start to harden, which is called fibrosis. Lymphedema is considered a progressive, lifelong condition. It requires daily self-management to be kept under control. It's often a misdiagnosed or poorly managed condition. Early detection and treatment is key. The best practice guidelines have been developed for lymphedema management, and ongoing research is occurring to help improve treatments. At this present time, there is no cure. Symptoms can be managed with proper treatment, but in some cases, even with good treatment, the symptoms can progress and become difficult to manage. Let's review the different types of lymphedema. Primary lymphedema is when the lymphatic system is poorly developed or has lymph nodes or vessels that do not work properly. Milroy's disease or syndrome generally expresses itself at birth or in the very early years. Mage lymphedema, also known as lymphedema precox, generally begins sometime during puberty, while lymphedema tarda begins in or around middle age. There are also some vascular conditions that are associated with lymphedema, such as hemangioma, lymphangioma, and port wine stains. Secondary lymphedema is the most common form of lymphedema. It's acquired as a result of damage to the lymphatic system. The most common causes are surgery, radiation therapy, injury, and infection. Lymphedema can develop many years after a surgery or injury to the lymphatic system. It is currently understood that the lymphatic system cannot regrow to its initial capacity. The following are some risk factors for lymphedema. If the lymphatic system is affected due to a surgery or injury, you are at risk for developing lymphedema in the associated limb. For example, if you had a lymph node removed from your armpit, you are at risk for developing lymphedema in your arm. The symptoms of lymphedema vary depending on the stage of the condition. At first, the symptoms may not be very obvious or noticeable. Symptoms can occur immediately or at any time following an injury to your lymphatic system. Therefore, it's important to be self-aware and monitor your body. The risk of developing lymphedema never goes away. Some individuals will develop it 15 years after a surgery or injury, although most of those who develop lymphedema will do so within the first year. Swelling is the most common symptom of lymphedema. You'll notice that your clothing, shoes, or jewelry may feel tighter than usual. This may be the first thing that you notice before you can even see the swelling. A change in sensation is also very common. The limb or area may feel heavy, tight, full, stiff, or even feel that there's pins and needles. You may even notice some skin changes. The skin in the affected area may feel tight or stretched. Sometimes the texture can even feel thicker. This usually doesn't occur until a later stage. If an arm is affected, you may notice restrictions when reaching above your head, or if your leg is affected, when bending your knee. Aching or shooting pain is also possible as a symptom of lymphedema. Health professionals find it helpful for communication to stage conditions. Stage 0 of lymphedema is also called subclinical or latent lymphedema. This means that there are no visible changes in the arm, leg, or trunk at this point, but you may notice a difference in feeling, such as a mild tingling, unusual tiredness, or slight heaviness. Stage 1, or mild lymphedema, is when the affected body part becomes mildly swollen. At first, you may even experience pitting edema. This is when a temporary small dent is made when you press the skin. The swelling is reversible at this point, and elevation will positively affect the body part. Such early-stage lymphedema is considered potentially reversible with treatment because the skin and tissues haven't been permanently damaged yet. Stage 2 lymphedema is considered moderate. At this point, the affected body part is even more swollen, and elevating doesn't help much anymore. Pressing on the skin does not leave a pit, and this is called non-pitting high-protein edema. At this stage in the condition, there are permanent changes to the tissue. Under the skin, it becomes hardened or thickened. This is called fibrosis. Stage 2 lymphedema can also be managed with treatment, but any tissue damage that has occurred can no longer be reversed. Stage 3 is considered severe. This is the most advanced stage of lymphedema. The affected limb or area of the body becomes very large, misshapen, and the skin takes on a leathery, wrinkled appearance. It's relatively rare in people with breast cancer and more common with lymphedema of the legs. Let's review the causes of lymphedema. Individuals with primary lymphedema are believed to be genetically predisposed to the condition. Surgeries can disrupt the lymph transport. This is the pathway between the tissues and the circulatory system. If you've had multiple surgeries in an area of your body or along the same pathway, this can increase the risk of developing lymphedema. The more lymph nodes that are removed or damaged, generally the greater the risk of developing lymphedema. Radiation can cause fibrosis in body tissues, which damages the lymph vessels or limits lymphatic flow through the area. Trauma, like burns, abrasions, or crush injuries, can damage parts of the lymphatic system, and a buildup of scar tissue in the area can limit regeneration. Infections cause inflammation and damage to tissues. If you get a recurrent chronic infection that comes back again and again and again, this can damage the lymphatic system as well. A higher than healthy body weight has also been known to cause lymphedema. This is because fat tissues have more capillaries and blood vessels, therefore more fluid to get rid of through the lymphatic system. Extra fluid from extra fat tissue puts a strain on a compromised lymphatic system, which can lead to failure. Chemotherapy itself may or may not influence lymphedema risk, but it can lead to weight gain. Immobility can lead to restriction of blood flow and lymphatic flow. It also limits use of muscle pumps that assist lymphatic flow. Cardiovascular conditions can cause inefficient circulation of blood and therefore buildup of fluid in parts of the body that will need to be eliminated through the lymphatic system. There is much debate as to whether or not air travel is a risk factor for developing lymphedema. Air pressure is lower on the airplane, and some believe that this leads to the slowing of lymph flow. Because of tissue damage from disease progression, uncontrolled diabetes is also another cause. Cellulitis is a real concern for individuals affected with lymphedema. Cellulitis is a sudden, non-contagious infection of the skin. People with lymphedema are at higher risk for cellulitis because their lymphatic system is less able to fight infection. Cellulitis is caused by an infection that got into the body through a break in the skin. This could be something as little as a scratch, insect bite, or a pre-existing wound or ulcer. It can also get through an area that has skin inflammation, for example, athlete's foot, eczema, or dermatitis. It may also not be possible to identify the cause, and an attack may arise without warning. It is very important to be able to recognize cellulitis, so watch out for these signs of skin infection in areas of affected lymphatic drainage. The skin will usually develop a rash or become red, hot, or tender to the touch, for increased swelling and pain in affected areas, or flu-like symptoms including fever, chills, muscular aches, pain, nausea, or vomiting. If you think that you have developed cellulitis, it is important to stop compression garment or other compression interventions and seek medical help immediately, as cellulitis can worsen very quickly. We recommend even drawing a marker line around the rashy area so you can see how quickly the infection is spreading. Tell medical staff that you have or are at risk for lymphedema. You will need antibiotics to be able to treat the infection. Once you have received treatment and have been taking your antibiotics for a few days, it will be safe to resume your compression garments and other compression therapies. Just to review again, if you develop cellulitis, it is very, very important to discontinue all treatments including bandaging, compression garments, pump therapy, manual lymphatic drainage until the symptoms have improved with antibiotics and the affected area is comfortable enough to tolerate the treatments to be resumed. Treatment of cellulitis and lymphedema is very important, not only because you may become very ill, but because lymphatic drainage routes risk being damaged further, in which case the swelling may worsen and permanent skin changes may result. If you have a history of repeated infections or recent infection, you may want to get a prescription for antibiotics from your doctor to have a supply ready at home or while on holidays. As lymphedema is a chronic and progressive condition, commitment to treatment and lifelong changes are the most important change for lymphedema management. Becoming educated on how the lymphatic system works, what the signs of lymphedema are, prevention of lymphedema, and infection control and skincare are also very important in lymphedema management. Lymphedema management programs are different from every individual, and your therapist will help tailor one specifically to your needs. Manual lymphatic drainage may be one of the treatments used. This is a gentle skin stretch technique that reroutes lymphatic fluid around compromised areas and improves lymphatic flow out of an affected limb. Learning how to do self-massage is also very effective. If you're able to do the massage for yourself, you can manage your condition throughout the day as you need. It can also be beneficial to teach a family member how to do self-massage techniques. It is important to note that manual lymphatic drainage has various levels of training. It is important to ask your therapist or massage therapist what level of training they have reached. Early levels of training are effective for healthy, intact lymphatic systems. If you have received damage to your lymphatic system from a crush injury or surgery, you require treatment from a more advanced level so that fluid can be rerouted around compromised areas. Short stretch compression bandaging may be another intervention used by your therapist. You may even be taught how to self-bandage at home. Once your condition is stable, compression garments are typically used. You get a choice of the garment type. You will be measured and fitted so that you fit your product and it is more comfortable this way. Exercise is also very beneficial for lymphedema management. Intermittent pneumatic compression pumps or lymphopress pumps can also be used as a treatment option, but it is very important to see a certified lymphedema therapist before using the pump. This is not an appropriate treatment option for everyone, and you need to be assessed to see if it will be okay for you. There are many questions that you're going to need to ask yourself as you develop your way to self-management. Some of these things include avoiding sunburns and insect bites. It's important to use insect repellents and sunscreens. It's important to use pH-neutral soaps and creams. Let's look a little bit further into risk reduction practices. Avoiding trauma to the affected limb as much as possible will reduce your risk of infection. This means keeping free of cuts, scratches, burns, and bug bites. Wearing long sleeves or pants when you're vulnerable to these things help. It is recommended to avoid needle pokes and blood pressure cuffs on the affected limb if possible. These things can put you at higher risk for developing or worsening your lymphedema. You could provide the medical professional with an alternate by proposing you use the other arm or leg for the necessary test. Some clients choose to wear medical alert bracelets, but there are debates on how real the risk is with blood pressure cuffs and needles. It is important to be in contact with a medical professional that is trained in lymphedema so that you can report any changes in the affected limb as soon as possible. It's important to maintain a healthy body weight and exercise regularly, but to follow the guidelines of your lymphedema therapist. You will want to start your exercises slowly and progress based on how the affected limb responds. It is important to wear your compression garments as prescribed. Please be meticulous with skincare and watch for signs of infection. There are specific types of products that we recommend. A pH that is similar to the skin is important. Skincare products that say that they are dermatologist recommended for sensitive skin and are without perfumes are the best for keeping your skin healthy and without cracks. It's important to also avoid constrictive clothing such as sleeves that are too tight around the wrist or armpits, pants that are too tight around the abdomen, rings and bracelets or different types of accessories as well can be constrictive and should not be worn on the affected limb. If you are scheduled to have a surgery on or near the affected limb that has lymphedema, you're going to want to ensure that you tell the surgeon about your condition so that accommodations can be made. It's a good idea to have an appointment with your lymphedema therapist prior to discuss your plan of action in the event that the surgery does cause a flare-up of the lymphedema. Try to avoid extreme heat or cold, especially to the point that it may cause a burn or frostbite. Even things like sitting in a hot tub for a prolonged period of time can be too much and trigger a flare of the lymphedema. It's important to learn your body's limits. Also avoid prolonged periods of sitting or standing stationary. When we sit or stand for long periods of time without taking breaks to walk or move, our limbs will result in excessive fluid accumulation and poor venous blood return into the limbs. And this is even a greater risk when you have lymphedema. As we discussed earlier, air travel may be a risk for triggering lymphedema. This does not mean that it has to be avoided completely, but precautions need to be taken to avoid a flare-up. It's important to wear a prescribed compression garment on the flight and to move and stand as much as possible when it is safe. Also, while you're flying, especially on long flights, try to stay well hydrated. This will help the lymphatic fluid move easier through your tissue. Regular exercise is an important part of lymphedema management. If possible, work with a specialized individual that's been trained in lymphedema management and cancer rehabilitation. Your plan should be individualized to meet your needs and your fitness level. Even if you were very active before your surgery, you will have to start slowly and carefully. Please take frequent breaks and listen to your body. Stop any activity or exercise that makes your affected or at-risk body part feel heavy, achy, or tired. Watch the area during and after the activity for any sort of redness or increase in swelling. If there are any changes in size, shape, tissue, texture, soreness, heaviness, or firmness, stop the activity. If it does not resolve after a few days, then please see your doctor or lymphedema management therapist. This kind of self-management and self-monitoring is very important when you're exercising. Make sure you're monitoring the sensations of swelling, and some people even choose to measure in consistent areas like at the wrist crease or at the elbow. Exercising any part of your body can affect your affected limb. If symptoms do arise, stop the exercise or modify it to be less intense. For example, if you're doing cardio activities like running and your arm is affected, the running will increase your overall blood pressure and heart rate that will affect the arm. You can do anything that you wish, but you need to progress slowly and as your body allows. As you get stronger, you will be able to tolerate more and more intense activities without causing a lymphedema flare-up. Your exercises should consist of a flexibility or stretching exercise routine. This is important to stretch muscles and connective tissue. It'll help to improve your joint range of motion and mobilize any scars. Strengthening is another important part of your exercise routine. This can actually help to reduce your lymphedema symptoms, especially when it's been used in conjunction with a compression garment. Exercises that are targeted towards strengthening should be supervised, and at the start, use low weights, low repetitions, and a gradual progression. Aerobic or cardiovascular exercises can also be resumed. This type of exercise is progressed gradually and helps to increase your heart, lung, and muscle performances. Walking, cycling, swimming, aquacides are all great examples of cardio. Here are some helpful guidelines for when you're exercising. Please allow adequate rest between intervals and between exercise sets. Avoid weights that wrap tightly around your affected limb and clothing that causes constriction. Wear your compression sleeves or bandages during the exercise if you are at high risk or already have lymphedema. Make sure that you drink lots of water so the lymphatic fluid can move easily through your body. Avoid extreme heat or overheating, and exercise in a circuit that alters the type of exercise and body part, so you're not overdoing one area of your body. Do not exercise through the pain. Skincare is a key part of lymphedema management. Make sure to keep your skin intact and minimize the risk of infection. Swelling may produce deep skin folds where fungal and bacterial infections can develop, so make sure to check and clean these areas regularly. Chronic inflammation also causes thickening of the tissue, and this can further compromise lymph flow. As mentioned previously, the type of soaps and lotions that you use are important to watch the pH level. We recommend dermatologist recommended, sensitive skin, non-scented. Ensure that after you wash, that skin folds, if present, are clean and dry. Monitor affected and unaffected skin for cuts or insect bites, as these are high risk for infection entry areas. Apply lotion daily so that the skin does not dry out and crack, and avoid any sort of scented products that are applied to the skin. Make sure to pay attention to nail care. Do not cut your cuticles and try to avoid hangnails. Protect any exposed skin with sunscreen to avoid burns and insect repellent so that you don't get any insect bites, which can actually lead to infections. When you're using razors, please use care to avoid nicks or any sort of skin irritation. Avoid punctures in the affected limb, such as injections and blood draws. There are other places that blood can be drawn, as in the other arm or another leg. Make sure to wear gloves when you're doing activities that may cause skin injury, such as washing the dishes, gardening, working with tools, or using chemicals. If you do end up getting a slight injury like a scratch or a puncture wound, make sure that you wash the area with soap and water and apply antibiotic ointment as soon as possible. Make sure you observe for signs of infection. Such infection signs could be a rash, itchiness, redness, pain, increase in skin temperature, fever, or flu-like symptoms, and make sure that you contact your physician immediately or even go into the ER if any of these arise. It could be as little as 30 minutes after a little scratch that cellulitis sets in. Research is starting to show that there is evidence that there is a connection between what we eat and the body's inflammation systems. Inflammation can cause lymphedema to flare up or to cause it to develop in the first place. Inflammation is the body's natural initial response to exposure to a foreign object or to the environment. This includes food and drink. Do your best to ensure that you maintain a healthy body weight and a healthy diet. There are dietitians available at most health regions if you want further education on anti-inflammatory diets or how to maintain a healthy body weight. We hope that you enjoyed our presentation today. Here are some other resources with lots of handouts and information on lymphedema. Please contact your local lymphedema therapist if you have any questions or concerns.